Well, welcome back to the news at 9. In today's Health Yes segment, we're talking about the importance of having a primary care doctor and what you can expect during your first appointment. So joining me now is Dr. Brenda Fortunate, a family medicine specialist. She's been practicing for more than 34 years. Thank you so much for being here.
Thank you.
You know, we're just talking about this. A lot of folks tend to neglect just a regular primary care visit, even for a checkup or a physical. You know, why is it important that we do this, that we go often?
Well, it's important so that someone can really know you as a complete person and understand all your health problems and your health risks.
Okay, now, you know, it's important too to establish a relationship with your family doctor, that you're honest with them. Explain a little bit about, you know, maybe the things you want to talk about at your first appointment with a new doctor.
It depends on why you're scheduling the appointment. Most of the time, people seek care with a primary care physician because they have an urgent care problem. They have a cold, they have a sprain, they have a flu, so they want to come in, have their problem fixed, and then they don't think about going back until the next urgent care problem.
So, you know, what preventative services can a primary care doctor provide?
I'm glad you asked that, because one of the big changes with the Affordable Care Act mandated a preventive health visit as part of the insurance package. And this is offered free without copayment and deductible, and it assesses your risk of developing cardiovascular disease. It includes screening tests for diabetes and high cholesterol, ordering screening tests like mammograms and colonoscopies. And all of this is critical. And if you just go for episodic care, you miss that.
Right. Now, we talked about how, you know, you really should go to
Yes.
see your doctor other than just when you're sick. So, you know, what type of other appointments are there that you see frequently?
There are really three different types of appointments. One is the episodic acute care appointment. Something just came up and you need to have it evaluated.
Sure.
Then there are the chronic ongoing illnesses like high blood pressure, diabetes, heart disease, arthritis, that require periodic follow-ups. And then there are the preventive visits for screening.
It's also important too, and this is something that likely any doctor will ask at your first appointment, but family history. Why is it so crucial to know that?
Because some diseases have an inherited risk. So if everyone in your family has had colon cancer, even if you are 30 years old, that might impact the way you're cared for. So you should know.
Right.
You should know what's going on with your family.
Absolutely. Now, you know, some of the steps maybe to mention, getting ready for your first appointment. What do I need to do to prepare before I come see you?
Well, you should have your family history. You should have your immunization history. You need your personal history with surgeries.
Okay.
And you need to bring with you in a bag all of your medicines and supplements.
Wow.
Yes.
Do you see a lot of people come in that say, well, I don't have any of that stuff?
Yes, all the time.
I would probably be one of those people, so I'm glad that I know.
Or they come in and say, oh, I'm taking something for my high blood pressure, but I don't know what it is.
I don't know what it is.
Yes.
You need to know what that is.
You need to know what it is, and you need to bring it with you.
So also, we talked about preventative care, but you know, a physical, that's sort of preventative in a way. So why is it important to get one every year? It doesn't matter how old you are, right?
No, it doesn't matter how old you are. The physical is a head-to-toe body exam.
Right.
But it's not a list to ask you what symptoms you might be having.
Okay.
This focuses on prevention, so they talk about diet and exercise and lifestyle and smoking and alcohol use and recreational drugs. They focus on that, and that's the thing that's included with most health plans now.
All right, great. Dr. Fortunate, thank you so much for being here with us. We really are just getting started because we're going to have another chat with Doctor after the 9 o'clock show here. But in the meantime, if you want more information about today's topic, getting a primary care doctor, please log on to the TV5 Facebook page or WNEM.com. Again, we will be there live immediately following the 9 o'clock newscast here to answer your questions.